முழங்கால் வலி போனால் நடை சுகம் வரும், நம்பிக்கையும் திரும்ப வரும். When knee arthritis pain reduces, comfortable walking returns. But many patients with knee arthritis wonder about one important question. Should they undergo knee replacement surgery? Or is there a biological treatment like PRASAD that may help preserve the joint? Before we compare these treatments, we must first understand where arthritis pain actually comes from. Many people believe that knee arthritis pain comes from damaged cartilage. But cartilage has no nerves. This leads to an interesting paradox in arthritis. The tissue that is damaged the most, the cartilage, is not the tissue that produces the pain. Instead, the pain arises from the tissues around the cartilage. One important source is the bone beneath the cartilage called the subchondral bone. When cartilage becomes thin, this bone is exposed to greater mechanical stress. The subchondral bone may develop stress-related changes and inflammation, often described on MRI as bone marrow edema. Because this bone contains nerve endings, these changes can produce the deep aching pain commonly felt in arthritis. Another important source of pain is the synovium, the lining of the joint. The joint is lined by a thin tissue called the synovium. This lining normally produces a small amount of joint fluid that lubricates the knee. When cartilage breaks down, tiny fragments enter the joint fluid. The synovium reacts to these fragments and becomes inflamed. This condition is called synovitis. An inflamed synovium produces excess joint fluid. This extra fluid collects inside the joint, causing swelling. As the joint fills with fluid, the capsule surrounding the knee gets stretched. That stretching of the capsule is itself a source of pain. The joint may also develop bony spurs called osteophytes. These extra bone formation can restrict movement and disturb alignment. As they enlarge, they may stretch the joint capsule and contribute to joint contractures. This affects surrounding soft tissues, including ligaments, muscles, and nearby bursae. These tissues may become tight or inflamed as they try to stabilize the altered joint. For example, tight structures on the inner side of the knee may irritate the medial bursa, which itself can become another source of pain. So knee arthritis pain does not arise from cartilage alone. It involves the subchondral bone, the inflamed synovium, the stretched joint capsule, and the altered mechanics of the joint. Different treatments address these problems in different ways. What knee replacement does? Knee replacement is essentially a structural solution. During the operation, precise bone cuts are made on the femur and the tibia. These cuts remove the diseased joint surface as a single unit, including the worn cartilage and the underlying subchondral bone. In many cases, the patellar surface is also resurfaced. This removes the damaged cartilage, the inflamed bone beneath it, and the osteophytes that restrict movement. The surrounding soft tissues are also balanced to restore alignment of the knee. In effect, the diseased joint surface is removed and replaced with an artificial implant. But surgery is not the only way to approach arthritis pain. Instead of removing the joint surface, biological treatments attempt to influence the disease environment within the joint itself. One such approach is a biological treatment called PRASAD. What is PRASAD? PRASAD stands for platelet-rich adipose stromal advanced derivative. It is a platelet-activated adipose stromal orthobiologic designed to influence the biological environment of the arthritic knee. PRASAD is a biological joint preservation treatment for knee arthritis. Its goal is not to replace the joint, but to influence the biological environment within the knee. An important feature of PRASAD is that it addresses two different sources of arthritis pain. The first is inflammation inside the joint. Biologic signals are introduced into the joint space to calm synovial inflammation. When synovial inflammation settles, the excess joint fluid also reduces. Earlier, this fluid had stretched the joint capsule. As the fluid reduces, the capsule is no longer stretched and that source of pain is relieved. The second component of PRASAD addresses the bone beneath the cartilage. In many patients, the subchondral bone may develop stress-related changes and inflammation, often described on MRI as bone marrow edema. Because this bone contains nerve endings, inflammation here can produce deep aching pain and sometimes night pain. In PRASAD treatment, biologic signals are delivered directly into the subchondral bone layer. The aim is to influence the biological environment within the bone beneath the joint surface. So knee arthritis is not just a cartilage problem. It involves both the synovium inside the joint and the bone beneath the cartilage. PRASAD attempts to address both of these biological sources of pain. But an important question remains. Which patients are suitable for a biological approach like PRASAD? Not every arthritic knee is the same. Some knees still have reasonable movement and only mild or moderate deformity. In such situations, a joint preservation approach may be worth evaluating. Many patients in India also wish to preserve natural knee movements such as sitting cross-legged, kneeling or sitting comfortably on the floor. These activities can sometimes be difficult after knee replacement. However, if the knee has severe deformity, very limited movement or structural collapse, then knee replacement surgery may be the more appropriate solution. The key is choosing the right treatment for the right knee at the right stage of disease. Let us now compare the two approaches clearly. Knee replacement reconstructs the structure of the joint. The diseased joint surfaces are removed, osteophytes are removed, and alignment is restored. PRASAD. PRASAD does not significantly change the structure of the knee. Instead, it attempts to influence the biological environment within the joint. By reducing inflammation within the joint and within the subchondral bone and by improving lubrication, it may reduce pain and may allow smoother movement within the existing structure of the knee. So the key difference is this. Knee replacement changes the structure of the joint. PRASAD works within the existing structure by influencing the biology of the joint. Before deciding on treatment, 3 simple questions can help. Does your knee still bend reasonably well? Is the deformity mild or correctable? And are you hoping to preserve natural movements like sitting cross-legged? If the answer is yes, a biological joint preservation treatment like PRASAD may be worth discussing. But if the knee is severely deformed, very stiff, or structurally collapsed, knee replacement may be the better option. If you are struggling with knee arthritis, the most important step is not choosing a treatment immediately. The most important step is understanding your knee properly. Some knees benefit from joint preservation approaches like PRASAD. Others are better treated with knee replacement surgery. A careful clinical evaluation helps determine the right option for you. So remember, knee replacement reconstructs the structure of the joint. PRASAD attempts to influence the biology of the joint. Both have their place. The right choice depends on the stage of the knee. Because arthritis is not only a mechanical problem, it is also a biological disease of the joint. முழங்கால் வலி குறைந்தால் நடை சுகம் திரும்ப வரும், நம்பிக்கையும் திரும்ப வரும். Because every knee is unique and every prayer posture is personal. I am Dr. A.K. Venkatachalam from the Madras Joint Rejuvenation Center. If you would like to explore joint preservation options such as PRASAD for your knee, you can request a consultation through the email link provided in the description below.